story to tell about something that happened to our family last week. I'm sorry, I try not to get emotional, but it was a scary story. They did an echocardiogram, which is a sonogram of the heart, and found that Billy was born with a heart disease. They went in there with a scalpel and did some kind of magic that I couldn't even begin to explain. He opened the valve and the operation was a success. It was the longest 3 hours of my life. So this poor kid, this is what he looked like on Monday. But this is what he looked like yesterday. Poor kid, not only did he get a bad heart, he got my face. Before 2014, if you were born with congenital heart disease like my son was, there was a good chance you'd never be able to get health insurance because you had a pre-existing condition. You were born with a pre-existing condition. If your parents...
My understanding is that it will allow insurance companies to require people who have higher health care costs to contribute more to the insurance pool that helps offset all these costs, thereby reducing the cost to those people who lead good lives, they're healthy, they've done the things to keep their bodies healthy.
At one point, she was seeing a cardiologist every week, so we're just incurring bills and bills and bills. And one of the concerns we had was we had a lifetime cap on our policy. And knowing how much health care she required to survive, she was going to hit that lifetime cap, and likely at a very young age. And when the Affordable Care Act was passed, it was such a relief. There's so many things that you can't control when you have a sick child, and you feel responsible, and you, as parents, you want to protect your child, and not being able to do that prior to the Affordable Care Act was such a devastating feeling. It's such a helpless feeling.
If your baby is going to die, and it doesn't have to, it shouldn't matter how much money you make. I think that's something that, whether you're a Republican or a Democrat or something else, we all agree on that, right? I mean, we do.